I'd like to talk to you today about a new mobile pain treatment program for neuropathy and peripheral neuropathy now available in Wisconsin. So this is a new and mobile program where our nurses come out to treat you in your own home for peripheral neuropathy. As you know, most people with peripheral neuropathy have a range of symptoms and problems, and it's typically caused by a range of different issues and conditions that you may already have. Pain, numbness, tingling, burning, all those things are common with neuropathy, and that actually makes it very difficult to get in and out of traveling cars, homes, offices, and doctors' office. All that stuff becomes very difficult when you actually have these chronic pain issues. So naturally makes sense to have a mobile treatment program for neuropathy in Wisconsin, right? So that's perfect. So what we're doing is called neurofunctional pain management. This is a combination treatment that uses three things. We've got electroanalgesic therapy, uh, IV hydration, nutritional therapy, and health coaching. And this combination is extremely effective at relieving pain. Over the years, we've worked with many doctors across the country. We've treated thousands and thousands of patients with this program. And the consensus among all those doctors is that an average of about 85% of their patients are achieving a greater than 50% reduction in pain. And that's a huge success, right? Some conditions are even more effective than that. A lot of the doctors we've worked with have said, yeah, neuropathy specifically, I see a greater than 85% success rate with that. But this is all just, what we're collecting from the doctors and trying to understand from their experience how effective the treatment is. So these three categories, electroanalgesic therapy being the first one. So it's an FDA cleared treatment category. It's very specific to the treatment of pain, but it is clear for the treatment of pain, and it is also reimbursed and covered by Medicare and commercial insurances. So this entire program that we're talking about here is covered by Medicare and your insurances. So electroanalgesic therapy is a high pulse electrical current that depolarizes pain neurons and produces a release of neurotransmitters and neuropeptides. Now, there are a lot of other different types of electrical therapies out there. A lot of them are trying to be, if you ask the industry experts, you'd say a lot of these newer types of therapies are trying to be like electroanalgesic therapy because this technology is patented. It has been in the market for 30 years, so doctors know what it is. So most of the other devices and concepts out there are trying to be like electroanalgesic therapy and achieve those same results. Though, electroanalgesic therapy is reimbursed and covered, and I think that's the big difference between this and most of the other options out there. Is this is actually covered. So the depolarization effect, right? What happens is there's a cumulative effect that occurs. If you go through the treatment once, you might have a little bit of relief. If you do that treatment on a regular basis for weeks, say follow our treatment protocol, which is twice a week for 8 weeks, you can actually achieve a long-term outcome of pain relief. You can achieve, we aim for 3 to 6 months. That's what we aim for almost all patients. I've seen plenty of patients go over 6 months. I've had patients coming back in a year later saying, yeah, I'm still out of pain. It works great. So some people respond very effectively to the treatment. Some people, it takes a while for it to catch up and actually work. But ultimately, being safe and effective, it's worth trying. Even if your outcome is only going to be a few months versus a year, it's still better than the other options, right? Medication, surgery, and interventional procedures that may or may not work. So electroanalgesic therapy as being the primary method of treatment that we use. And I have a lot of people that ask this, and I'm sure you're probably thinking this: if it's so great, why haven't I seen it already? Why aren't I being offered this in why am I not being offered this in doctors' offices all the time? And the short answer is it's just like I mentioned, it requires multiple treatments over time. Most doctors just do not have time to do this. There are a lot of doctors that know what this is. I mean, there's hundreds of doctors around the country that know what this actual therapy is. Very few of them actually use it. In fact, most doctors I've talked to who do know what this is, I mean, they might even have a device in their office on a cart and they're not using it at all. So just one of the facts of life here with when you have limited amount of time, you have a lot of patients, you just can't spend hours and hours on each patient treating them specifically for a pain condition. So obviously we're in an opioid epidemic and an opioid crisis, and historically, doctors would be able to manage all these pain patients by simply prescribing some medications, and the patients would work with them that way. And obviously, that did not work out too well across the country. Over time, created a lot of problems. But that's because pain is difficult to treat. There's just not a lot of options out there. And at the time, opioids were being presented to the entire medical community as an effective treatment for pain. So there you go. Doctors doing the best they can to treat their overflowing offices for pain, and they have no other options. Well, nowadays you see a lot of pain doctors have shifted into what's called interventional procedures. So they're doing spinal injections and joint injections, and they're doing implants and all sorts of procedures. A lot of these doctors will become a part owner of a surgery center, and they will send all their patients to that center and have those those procedures performed, because they can actually, doctors can make much better money for the time spent doing one of those procedures than they can doing a repeat time-based treatment in their office on electroanalgesic therapy. So aside from all of that, I do tell people there is obviously a need for all of these other procedures. Right? There's definitely scenarios where the patient needs that. There's definitely scenarios where the patient needs a surgery. So there's all sorts of scenarios where those things are needed. But this is what I tell everyone: if you're a patient and you're staring at a list of options, and you see medications, surgery, invasive interventional procedures where they're injecting steroids into your spine, into your spinal cord, um, or you see this, which is a safe, effective therapy that's topical and it's covered by Medicare and commercial insurance. It's not invasive, works great, can get you out of pain for months and months. Sometimes patients doing this program have longer outcomes. And actually, this is pretty common because most of these interventional procedures are also temporary. They only last a number of months typically. Our program can also last a number of months, but we didn't have to actually perform an invasive procedure to achieve it. And sometimes, again, patients can go for a long time, a year or more. So being a safe and conservative therapy that's covered by insurance, why wouldn't you pick this one first? And that's the question I've asked a lot of patients. And, they jokingly say, well, of course I'm going to pick the safe, conservative one. And now, on top of all of that, I'm even more likely going to pick this because they come to my home and treat me there. So I don't even have to go into the office to have the treatment done. So that's just a grand slam home run of success for getting patients treated because we can actually do it in their home. So, okay, so electroanalgesic therapy is the first component. The second one, IV nutritional hydration. So most chronic pain patients, and I think a lot of doctors agree with this, most chronic pain patients are also chronically dehydrated and typically chronically nutritionally deficient. They're just short on a number of different vitamins and minerals that are essential for assisting in, inflammation reduction and pain relief across the board. So this vitamin mineral mix that we have with this program works amazingly well. Over the years, many doctors that have done this treatment, some of them were doing just the electrical treatment, and it does work by itself. It will work just the electrical alone. When you combine it with the IV hydration, there is definitely an enhanced outcome. So when we say we've seen an 85% success rate in treating chronic pain, we're talking about a range of pain conditions, maybe a couple dozen different types of pain, and we're talking about the combination of the electroanalgesic therapy and the IV combined. Works amazingly well. And the IV is only once a week, whereas the electrical therapy is twice a week. And so you have two treatment events in your home, and the nurse will do that on site in your home. So the third component is health coaching. What we've noticed over the years is that as patients start getting out of pain, they start to feel obviously better and motivated. So for the first time, sometimes in years or decades, they are motivated to actually start being healthy again because now the pain is gone. If you have neuropathy pain and you can't hardly walk, first off, you're not getting exercise, you're sitting a lot, and you're probably disappointed and unhappy with being able to get out and do things. So you typically don't have the best diet, not really trying on the side of health and wellness and nutrition. So I've seen a lot of patients in that situation. And I've actually had people talk to me say, yeah, well, I mean, I'm in pain every single day and the pills don't do anything for it. The only thing that I enjoy is my treats, my snack, my drink, whatever it is, and that's what they look forward to because nothing else is actually working as far as pain relief goes. So once they get out of pain in this scenario, all of a sudden the door just opens up to, well, now I want to be healthy. Well, heck, I'm going to start eating better. I'm going to start getting out, getting some exercise. I'm going for a walk today because I can go for a walk today. So all of those things start getting better, and the health coaching helps that process occur faster, and it helps the patients figure out goals and work towards those, and the nurse will help you do that as well as everything else in your home with those treatments. So going forward here, we have a mobile pain treatment program. This is called the RELATYV Mobile Pain Treatment Program, available now in Wisconsin. And specifically right now, we have this program available to treat peripheral neuropathy for you in your own home. So look forward to hearing from you on this. We have a link here in the comment, or sorry, the description of the video here. There's a link for you to check and see, fill out your insurance form, check and see if we can get you covered. It does cover insurance, Medicare and commercial insurances cover it. We just have to do the check to see what your scenario is for your current plan. But yeah, we can absolutely do that check for you. Our team will reach out to you, figure out what to do next to get you going in the neuropathy treatment program. Looking forward to that, and our nurses are looking forward to meeting you and treating you. Fill out the link below. Let's get you started. Thanks so much.